Our next guest lecture is on medical legal issues in cardiology. Our invited speaker for the next 7 minutes is Advocate Mahendrakumar Bajpai, who is currently practicing at the Supreme Court of India in New Delhi, and he is the Honorary Director, Institute of Medicine and Law, New Delhi. To help Advocate Bajpai be on time, we have 7 minutes straight across, and since this is a guest lecture, we'll not be having questions. The 7 minutes will be followed by a brief comment.
Medical legal issues is a real problem in India. It's not only a problem of the Western world. In India also, there is a sudden emergence of medical legal issues. And we thought to call a most eminent person from Mumbai, and he is none other than Mahendrakumar Bajpai. I'll request him to start the presentation. Mahendrakumar Bajpai.
Dear friends, a very good morning. I know of two powers whom one cannot say no. One, obviously, we all know is the Almighty. The other, present amongst ourselves, is Dr. Chopra. I am organizing a national convention on medicine and law day after tomorrow in Mumbai. Medico-legal experts from across the country are coming there. But when Dr. Chopra says you have to come, it's simply not no. Friends, we come straight away to the topic. This is a cause of concern. Compensation of 11 crore rupees in a developing country like India. What ramifications it's going to have on the healthcare sector? Everyone has to contemplate, whether it's the patients, doctors, policymakers, or the opinion formers. I know I've come here not to speak on this issue, but to point out mistakes done by cardiologists in their day-to-day practice, some very basic precautions if you are able to take, your risk, the chances of the patient going in court would be reduced considerably. Number one, and I'm going to speak in simple English, non-legal language, though I am an advocate. Please understand, law considers you very special, and it expects more from you. You have to be more circumspect, you have to be more judicious. So, as compared to a commoner, your standard of care has to be higher. Number two, and that is standard of care. This is one topic which needs a full day. And the relevance of this topic is because cardiology today happens to be a specialty which is developing with every passing day, and you at times come ahead with problems for which you don't have any solutions. You know, there's an ailment, there's a treatment. Should I take A? Should I take B? Should I take C? What is the role of law? Very clearly, law says that anything that is acceptable to the science of medicine and is acceptable to the practitioners of that specialty is acceptable to law. So friends, in treatment, in procedural aspects, whenever you are in a dilemma, please refer to your standard texts, and you may, obviously, if you are not satisfied with that, if you are still in a dilemma, consult your peers. This will give answers to all your questions. An injury, a death by itself is not negligence. You need not be anxious. As far as doctors, especially consultant physicians, are concerned, the fact that they represent themselves as cardiologists, law considers it as negligence. So be aware, on your letterheads, on your stationery, if you are using something that you are not there, something that is not recognized by MCI as a qualification, you are negligent in the eyes of law. Next problem for cardiologists is the referral note. The cases that are coming today, we find that Either the patient does not bring the referral note, or the referral note that is brought is not preserved by consultants. This again is a cause of concern. So friends, insist on the referral note and see to it that you preserve the referral note with the medical records of the patient. I also happen to be the editor of a monthly law reporter, and statistically whatever I am saying is correct. 2/3 of the problems that doctors in India face is because of improper consent and improper documentation. And I, as an advocate, am very happy. And the reason is that it is all procedural deficiency, which is perhaps causing a lot of problem for you. Patients here are not challenging your skills, your expertise as a doctor. So friends, a little bit of care, a little bit of awareness on medical legal problems, on legal procedural issues, and 2/3 of your risks are wiped out. Friends, I have consent. I would like to say something on consent because consent happens to be one of the major problems that doctors are facing in India. Number one, some very common mistakes done by doctors in India. You ask the patient, we have to go in for a surgery. The patient refuses, or the patient takes time in giving you consent. Doctors in India don't record it anywhere. Gravest mistake. What is needed from you is a simple 2-line in that consent. Consent of the patient sought at so and so time, consent of the patient given at so and so time. And you are indemnified from all consequences that arise from that. Number 2, please understand, an adult patient who is oriented, only that patient can give consent, none else. In India, we are a family, so you either take consent of the spouse, of the children, or of the parents. It's wrong, it's illegal, it's negligence. Number 3, let us skip number 3, we'll come to number 4. Please remember, you have to take a separate and specific consent for blood transfusion. Usually, in the consent for surgery, you have a single line where it's written consent for blood transfusion also. No, it's illegal. You have to take a separate consent for blood transfusion. And in case of patients who are between 12 and 18 years of age, please take consent of both the patient as well as the guardian. If it is below 12, you take consent of the guardian. Above 18, only the patient. Friends, I think I have, that's all that.
Dr. Pelajani, your comments.
Thank you very much for a very, very illuminating presentation. And I think you are right that today India is going through a phase which America has been going through for the last several decades. And the problem is that in America, the insurance companies and doctors could afford at one time. But at present time, when this kind of legal lawsuits come, where so much of money is to be coughed out by the doctors, I think it is going to escalate the cost of the medical care. But I agree with you that I think many a times the fault lies with us. And I found in my clinical practice, one very important thing is communication. I think we do not communicate with the patient or the patient's relatives, explaining them the type of procedure that we are going to carry, the risk that it is going to carry, and while the procedure is going on, is in the process, I think we don't keep on informing the patient that suppose, for example, the patient has become serious. The relatives are not even made aware that the patient is becoming serious and we are taking all the precautions. I think communication seems to be the most important thing that we lack in our country. I think that's once that is done, I think 75% of the problems can be over, except barring a patient who just wants to kind of file a suit for just making money.
Thank you.
Communication and documentation, two things if are taken care of, I think 95% of the problems of doctors as far as law is concerned would be wiped out.
Dr. Tiwari?
Uh, I am Dr. P. N. Tiwari, a medical legal advocate in Delhi. Now, we have heard about the legal perception in medical profession in general. To the topic, specifically, I'll ask what is the medical legal issue pertaining to cardiology, especially in TEE, that is the transesophageal echocardiography.
Number one, I am an advocate. Okay, I have nothing to do with medicine. Whether a cardiologist comes or a gastroenterologist comes or whosoever comes, I have to represent him in court. And again, this is one wrong notion that doctors carry with them. Our journal comes and a doctor says, look, it's a case of gastroenterologist, I will only read those cases. It's patently wrong.
Dr.
If a gastroenterologist has written a wrong prescription, the same mistake can be done by a cardiologist also. So,
no, mine
Dr.
is
Parashar?
Mine is not a professional comment, suggestion. When you call him next year, please give him 20 minutes.
Okay.
no, I have 70 minutes ka 7 minutes mein kiya hu sahab. And I have to rush back to Mumbai.
I think it's very important. We are very grateful to Mr. Bajpai, who has come all the way from Mumbai just to want to give a message and the importance of consent taking.
Okay.
His focus is only consent. Please take a message. It's a huge topic, consent. It may take an hours together. I think we'll invite you again, sir. I think the need is there. Our chairman has spoken very clearly. The time was less. We have to give you more time. I think I'll request all the chairpersons to join me here to hand over the token of appreciation. Dr. Pelajani, Dr. Parashar, and everyone. Please.
Thank you very much, Advocate Bajpai, for being here with us. We look forward to having you again. Ladies and gentlemen, we now would like to thank our chairpersons as well.